Hello and welcome to the emergency department at Sherwood Forest Hospital. My name's Julie Dixon, I'm the head of nursing here. We're a very busy department and we can see between 220 to 250 patients per day, and on a very busy day can see up to 300 patients a day. Of those patients, there are patients we call majors, who are patients who are seriously ill and who arrive by ambulances, and we can have between 70 and 90 ambulances arrive a day. We see most of our patients within 4 hours. That is, they are seen, treated and either discharged or admitted to a hospital bed within 4 hours of arriving at the hospital. When you arrive at the hospital, if you come on your own steam and are a walking case, you'll use this entrance. Patients who arrive by ambulance will be brought in by a stretcher through this entrance, and in more serious cases, staff will come out to greet the patient. When you arrive at the hospital, if you are a walking case, you'll be asked to present to our reception, where the receptionist will take details of your name, address, date of birth, etc. when you're presenting complaint or injury. Following registration, you'll be asked to wait in our waiting room. We aim that we see all patients within 15 minutes of arrival. You will be seen and assessed by a senior nurse. You may then be asked to go back to the waiting room to be seen by a doctor, or you may go directly to X-ray, for example. Occasionally the department can be very busy, and there is a large area behind here where patients are treated with major illnesses and injuries. Those patients will always be prioritised. If that is the case, critical illnesses will be treated first. We will always aim to keep you informed and keep you informed of the reasons why you are waiting.
My name is Richard Clarkson. I'm the acting department leader here at Kingsmill in the emergency department. Here in our minor injuries area, we see a lot of patients that present with injuries such as sprained and broken limbs, ankles, fingers, wrists and toes and things like that. We also see a variety of wounds, burns, scalds. We'll also see minor head injuries, patients that present with minor illnesses such as earache, sore throats and dental problems. Here in the department we have numerous rooms, one of which on my right here is the streaming room, which is where all patients are initially assessed by the streaming nurse and their needs will be assessed and a plan of care will be decided. Another room we have is our suture room, so this is where majority of patients who have wounds will be assessed. The wounds will be cleaned, closed, either by sutures, steri-strips or glue, and will then be dressed prior to the patient being discharged home. Unfortunately, some people sustain a fracture. In that instance, we have to put the patient in plaster. So what we're going to do now is just got Mr. Davis here, who has sustained a fracture to his distal radius, and we're going to pop him in plaster. You all right there? Well, you need to keep this dry. Once patients have been seen by either a doctor or a nurse practitioner here in the minor injuries department, they will be discharged either to any clinic, which could be a fracture clinic, or they'll be discharged asked to go and see the GP in the next few days for either like a dressing changed or just follow-up of their condition, or they could be discharged with no follow-up. In a small number of cases, patients will require admission for further treatment and investigation. If that's the case, then they can be transferred to the appropriate ward from the minor injuries department.
Hello, I'm Julie, this is Cindy. We're both care assistants in the emergency department. Our role is to assist the nursing staff. We do duties like ECGs, observations, blood monitorings, take patients to X-rays and deliver them to the wards if they are staying in. If you need us, we're in the royal blue uniform, so if you need any assistance, just give us a shout and we're willing to assist you.
Hi there, my name's Dr. Karen Sutherland. I work here as a specialty doctor in the emergency department. We look after all sorts of patients, from people with minor injuries right through to major injuries, very sick medical patients and trauma patients. And we wear a bright green uniform so that anybody can locate us at any time and we stand out from the rest of the team.
My name's Sarah. I'm one of the staff nurses wearing navy blue, working in the emergency department. My role is to see, treat and assess patients coming through emergency care. So if you need anything, just ask the nurses in blue and we're here to help.
Hi, my name's Cheryl. I work for the ambulance service, so I'm training to be paramedic. We work closely with the hospitals when we bring patients in. We need to ensure we have quick handovers because that's for the best interests of the patient and also so we can get out and carry on and do further jobs.
Another area we have here in the emergency department is our majors area. In this area we will care for patients that present with strokes, heart attacks, diabetic problems, collapses and more serious road traffic accidents. In this area the majority of patients will arrive by ambulances. Each patient will be assessed by one of our nursing staff in one of our 19 cubicles. Investigations such as heart tracers, blood tests and x-rays will be carried out. The more sicker patients will be cared for in resus. So we're now in our resuscitation area. This is where we care for our most sickest patients. Patients in here will be closely monitored on a one-to-one basis by our nursing staff and our healthcare assistants. We have 7 beds. One of those beds is dedicated for children. Once our patients have been seen by the doctors and a plan of care has been decided, they will be transferred to one of our wards if admission is needed. If not, the patients will be discharged home and supported in that discharge and asked to see the GP if necessary.
Hello, I'm Ben Owens. I'm the lead consultant here at the emergency department at Kings Mill Hospital. The department runs a single point of access system where if you're seen by your GP and referred into the hospital, you'll be seen in the emergency department first. This means that you get more rapid access to a senior doctor seeing you, you'll get rapid access to investigations and treatment, and it also means that if you don't need to come in hospital, we can help you out and discharge you if we can. This has led to a 30% reduction in admissions to the hospital and also an average of 50% of patients being seen by a doctor within the first hour of arriving within the hospital. One of our recent changes is the out-of-hours GP service, which used to be in Byron House, is now co-located next to the emergency department. When you attend the emergency department now, if you have a condition that's most appropriate to be seen by someone from primary care, such as a GP or a nurse practitioner, after being assessed by the triage nurse, you'll be triaged to the primary care stream. The idea is, as much as possible, you're seen by the first person most appropriate to treat you first time. In the emergency department, we try and give a comprehensive service to all patients. We have specialist nurses who work with people who suffer from domestic violence or drug and alcohol abuse, trying to provide advice and assistance for patients if they attend the department with these needs. One of the quality schemes we run in the emergency department is our EDAS support scheme. This is a service of trained carers who assist elderly people who've attended the department who don't need to be admitted but will be difficult to get home without support. They will take a person home in a car, make sure they're in their house, make sure the heating's on, make sure they have food.
The door's open because wife's at home.
All the things they need for that evening. They'll then do a follow-up visit or phone call the following morning. I can actually access up to 3 days of emergency care support, just enabling people to stay in their own home rather than being admitted to hospital or a nursing home.
My name's Lindsay Brown. I'm part of the EDAS team, which stands for Emergency Department Avoidance Support Service. We wear the light blue uniforms. We work within the emergency department, so if you need extra support home, then we'd be happy to help.
Hi, my name's Tina. I'm one of the paediatric staff nurses within the emergency department. In this area, this is where all the children and young people come to be seen by a nurse and by a doctor. So when you come through the department, you're initially seen by one of the triage nurses, and we then place you back out into the waiting room where you're waiting to be seen by a doctor. During that time, we have various areas where the children and young people can wait to be seen by the doctor. We've got our young adolescent area where there's a television and an Xbox. We've also got a soft play area and another Xbox. That's where the younger children can play and wait to be seen by one of the doctors after they've been triaged by a nurse. We also have some projector screens within the department, so when you need things like wound closures and other treatments, we have lots of things that can be used to distract for that as well. We're really proud to have this department. It is open 9 till 9, so 9 in the morning till 9 in the evening, and it just makes it a really positive experience for both children and parents who come in. It's separate from the adults, so children are waiting in a separate waiting area. It's really reassuring because it's such a lovely environment and there's lots of things to distract you, and it makes the experience a lot less scary.
We're We're really proud of our fantastic new facility, which has tripled the department's size in the last 3 years. We have a very multi-skilled team here encompassing all aspects of emergency care, and we are achieving all of the emergency care standards, ensuring timely treatment of patients. We're working very closely with East Midlands Ambulance Service to ensure that almost all of our patients on arriving by ambulance are seen within 15 minutes to release the crews back out on the streets to do their job. We've also recently been accredited as a major trauma unit, the first one in the region, and for a stroke thrombolysis service as well. If you do have to come here, you'll be seen by a highly skilled team whose sole aim is to deliver the best quality care that we can within the emergency department.